Hello, everyone. Welcome to the session of Fever in Children by Apollo Cradle. We have with us Dr. Harish here from Koramangala Center of Apollo Cradle. He's an in-house senior consultant. He's an in-house pediatrician working with us, and he'll be talking about the topic of high fever in children. So, what are the things to be taken care of, or what to look for, or when to visit a doctor, or what should be the first thing that you need to give to a children. So, all these things he will take care of. Uh, if you have any questions, do let us know. Doctor, we welcome you to this session, and it's all yours. We are looking forward to hear from you on this. It's something which every mother always dread of what to do when their kids or when the child gets a fever. So, we are looking forward to hear from you on this session. Thank you.
Uh, hi everyone. I'm Dr. Harish. I'm a senior consultant, Apollo Cradle Hospital, Koramangala. So the today's topic of discussion will be what is fever in children or what is high fever in children, and we are going to discuss on the parental point of view what and all we have to look for and uh, when to give the medicines and when to be coming to the hospital. So there are basic things that we are going to discuss on the parental point of view. We are not going deep into the etiological parts and all, but we will give you a general awareness of what to do and when to do all those things regarding the high fever. So let's come to the fever by definition. What exactly is the fever means? So fever is something that is abnormal body temperature. So the normal body temperature is between 36 to 37.5. So any temperature which crosses beyond 38, so we will label it as fever. So 38 through Celsius and 100.3 through Fahrenheit. So if the temperature crosses beyond that, so we should label it as fever. So when we say to be defined as fever, so where exactly we have to measure the temperature. So that comes the point of our discussion also, because this is a common mistakes that most of the parents do. They will not, first of all, they will not check the temperature. So here I'm saying like you have to monitor, you have to check the temperature, because many times the baby's body might be feeling warm, but the actual temperature may be normal also. So to define or to label it as to the child to be having a fever, we have to check the body temperature. So when we say how to check the temperature, there are different sites to check the temperature. So we'll go according to the age and according to the sites also. So first, the most precise and the most correct way of checking the body temperature will be per rectal, through the rectal region, where we insert a digital thermometer to check the temperature. So I'm not going to deep into how to do it and all, because I'm not recommending you guys to do it in home, the rectal ones, because it will be a little difficult or also the parents to do it. So this is the right way of doing the measuring the temperature. So if sometimes we'll not be able to do this, no worries. So there are other sites where we can check the temperature, but the accurate way is through to check the temperature through rectal region. The second comes your the armpit region. So the armpit region, where we will keep the thermometer, okay, the digital thermometer, which is perpendicular to the forearm. So, and we will allow the thermometer to read the temperature. So, if it reads more than 99.1, so because the temperature at the axillary region will be different compared to the normal core body temperature. So, if it reads more than 99.1, we label it as fever and we have to give medicines accordingly. Then comes the third area where we can measure temperature is oral region. So we are below the buccal, below the tongue. Okay. So where we this site is very important, because again this we can't be able to do it in smaller children. We only can do children who are more than 4 to 5 years, where there are other factors also which matter. So before you check the temperature, make sure the child has not have any sort of warm food and gargled with warm water, drank warm water and all. So you just make sure the child is comfortable and the child is sitting in proper way, and then you check the temperature for about 2 minutes and say and read this. So if the oral temperature is reading more than 99.5, then we label that as fever. So these are the common areas. There are other areas, one which we use, not the digital ones, where we use the infrared thermometers to check the check the temperature. The two most common side, one is the side of the head, that is the temporal region. The other one is the ear. So in both the cases, we use the infrared thermometer. So where we, when we are measuring the infrared thermometer, so when we are checking through the ear, so we will place that infrared one close to the tympanic membrane, eardrum, and then we will do it. This is the easy. I mean, this is difficult again because the process of conducting the checking the temperature itself is difficult, but it gives sometimes a short duration. So you can easily go inside and come back, but this also gives an accurate result. So the ear and the temporal regions are the two different sites where you can measure the body temperature. So then comes so whether most common question from the parent side is what is the difference between the infrared and the digital one? So there's not much of difference between the infrared and digital. So if at all, if the parents have something there they can measure, so I am always tell them to go ahead and do the digital because that is the easiest at, I mean, it gives an accurate reason. So I mean accurate records also. The infrared also in the smaller children's, yes, they will be very easy because they are not cooperative. So I sometimes because the process of measuring the temperature itself will be difficult in smaller children. So I recommend in very small children to go ahead and do the infrared thermometer checking. So neither of them have accurate results. Again, you have to correlate clinically also. So when you say when you check the temperature and you clinically if the child is not feeling that warm, you redo with the both the thermometers and see if suppose there is a clinical correlation and the thermometer also showing high records, that means your child is definitely having a fever. So then we will discuss like what are the different symptoms that we will see in when the child has fever, and when to come to the hospital to monitor, or when to come to the hospital to show it to the doctor and to further evaluate also. So when we say fever in smaller children, those children who are below 3 months, okay, so we'll go age accordingly. So in a child who is newborn to till 3 months, any temperature is sort of medical emergency. We don't expect them to get fever at any by any means. So if at all if they are getting fever, then we have to properly evaluate them to find the focus of infection, where exactly is the child having infection and all those things. So we have to find it out and we have to treat accordingly. So what is the recommended temperature? If suppose 0 to 3 months children who is having temperature more than 100.3, so we have to evaluate them for the bacterial causes of fever before we label to other causes. So we have to do the certain blood investigations to like basic total counts and the CRPs and the urine infections, UTI, and all that could be contributing to all those things. So we have to look for all those things and then we have to go further. If the child is having any sort of bacterial infection, we have to treat them. So then apart from the fever, what else the 0 to 3 months babies can have? So in any baby with fever and they have refusal of feeds, that means a child was absolutely fine and suddenly started not drinking milk. Okay, child is lethargic, what we say in medical terms. The child is not passing lesser urine. That's because baby is not feeding well. Okay, child is having any abnormal movements that because of the convulsions or fits, what we say. Okay, child is having excessive crying, irritability. Okay, so keep on crying without no reasons. You can't able to console the child. So in those circumstances, it could be some major bacterial infections that might be contributing to the child's fever. So that will you have to identify and we have to treat it accordingly. So in any patients or any parents who see that like, their baby is having fever below 3 months, you have to come to the hospitals to show it to the doctor, and doctor should evaluate further in case if they feel there is a chance that child might have acquired any sort of infection, right? Then comes the later age groups, like what if it is crosses beyond 3 months till 6 months? Again, the temperature definitions will change, and most of the times, again, between 3 months to 6 months, you will wait till the baby to cross the temperature of 101. Sometimes excessive wrapping the clothes and all those things can also lead to a mild increase in body temperature. So you have to look for all those things apart from whatever the things I told. If the fever crosses like 101, 102 in even between 3 months to 6 years, you have to come and visit us so that we have to look for the causes and we have to evaluate further what might be the reasons for this kind of fever. So after that, from 6 months to 2 years, okay. So 6 months to 2 years, you can wait for about at least 24 hours before we do any sort of evaluations and all, further evaluations and all. In those children, 6 months to 2 years, many of the times they might have acquired bacterials, or sometimes there is a family history of any sort of cold, cough, viral infections, which suggests that child baby might have also acquired the infection from them, and that might be the reason why the baby might be having fever. Again, the appearance, again, how that baby is more important than the symptoms itself. So if your child is not doing fine with respect to the well-being of feeding and activity and passing urination, so if those things are not fine, then probably you have to come earlier than 24 hours. Otherwise, you can wait for the child's temperature to settle down in 24 hours. If not, then you have to come and visit the doctor. So this is between 6 months to 2 years. So beyond 2 years, again, they are the older children. They will be able to tolerate the temperature. They will not be having much of again fuss and all. So, but still, if they are all again as I discussed, so it is all the appearance of the child. It is all the well-being of the child. Even just because they are more than two or more they are older children doesn't mean like you have to wait for longer days. If suppose if the child is all doing fine and temperature is crossing 102 and child is doing all his normal activities, you can wait for 48 to 72 hours before the fever to come down. If the fever after 48 to 72 hours still has not disappeared, then you have to come and visit the doctor to just to look for whether we require any sort of evaluations to find the focus of infection. So this is how we have to monitor the fever and when and where you have to visit the doctor. So these are some basic things that we are going to discuss. So when we say high temperature, the temperature is as we discussed, it is 100.3 and above at particular site. If suppose the child's temperature is crossing beyond 102 or even 104 at any point of time, you have to come to the hospital just to look for the focus of infection. Okay, so what are the myths which are associated with the fever? The common myths, the most parents know whether my teething causes fever. Definitely, that teething will not cause fever. There's no proven literature that the teething is going to cause fever. Then comes the other myths like whether should I do the sponging and all those things when baby is shivering. So we have to understand here what is shivering means. Okay, so when we say shivering or rigors or chills, the babies generally sometimes some of the parents will discuss regarding these aspects. So the chills means like see whenever there is an infection, any sort of bacterial, viral, or any sort of infection. So when the bacteria or virus enters into our body, so the body will start to respond, right? So the body has to increase the uh, body temperature just to make sure okay, it makes the whatever the infection is there to clear up. So how does the body do that? The body sets at higher temperature. So there is a site what we call as hypothalamus, which regulates our temperature. So this increases the basal temperature of our body. Okay, so this is only setting the temperature, and our body has to behave to that by increasing the whole body temperature. So how does that do that? Means like there are muscles under the skeletal muscle which starts to contract. Okay, so that's why you see the babies will shiver, and even though they feel cold, okay, the chills will be there, but they're still doing the rigorous movement. So this is because the body is contracting, means the skeletal muscles, your muscles in the body are start to contract, so that the temperature in the body is increased. So that because it makes the uncomfortable for the infection process, and that they will be evaluated, they'll be eliminated through the body. So this is the process of shivering. So shivering is something which the most parents will come across. It is not a convulsion. Okay, so you have to differentiate again what is shivering and what is convulsion. When we say conversion, it is something like you have to see the child will be doing the same movements like tonic, clonic, shaking the body and all those things. But again, so you have to see what is the sensorium of the child. During the moments of shivering, the child will be alert. Child will be alert in the sense child will be oriented. Okay, so you can talk to the child during that period of time. But during the time of conversion, the child is not responding. Okay, so that's how you differentiate whether my baby is having convulsion or my baby is having shivering. Okay, you have to look into it. So if the child is responding to your thoughts and all, child is oriented to the place and all, then you should not be worrying much. So if the child is not doing all those things, probably it is could be convulsion, where the fever induced convulsions, what in medical terms we call it as febrile convulsions. Okay, so this is a common questions, common dilemmas that the parents will be having when they see high temperatures with some shivering and convulsions and all. So next to be come to the discussion of like what to do when the temperature is there. Okay, so again, so the first line of management when the temperature is going beyond normal is you have to see the appearance and activity and the previous history of any sort of febrile convulsions is there or not. Suppose if the child is absolutely fine, even though there is a low grade fever of 100, is there, and child is not doing anything, you don't have to do anything apart from just hydrating the child. Okay, you don't have to give paracetamol also. You just make sure you give adequate liquids to the child. Okay, give plenty of fluids. Okay, if the temperature is shooting up, you can do some lukewarm sponging. Okay, don't do with the cold water again. So do with the lukewarm water. Okay, so when you sponge it, automatically the temperature will come down. So in this way, you don't have to give medicine so that like the child necessarily will be giving medicines to the child. Okay, suppose if there is a family history, or else if there is a child is having previous history of fever followed by convulsion and all, then definitely yes, you have to give paracetamol. Okay, because that is the only thing which saves your child from having the second episode of febrile convulsions. Okay, so these because when the sudden spike in the temperature happens, a child might develop another episode of febrile convulsion. So we recommend you to give from paracetamol. Okay, so in case if the child had a family history or else previous history of febrile convulsions. Okay, so then comes like the what and all. What is the second line of if suppose most of the times the parents do say regarding even after giving paracetamol the temperature has not come down. So again, the second line of medicine, ibuprofen and mephtal and all those things are there. But again, we don't recommend ibuprofen or mephtal in smaller children's in children who are less than 2 years also. So those children who are more than 2 years, you can go ahead and give a bit of ibuprofen provided your doctor advises. Don't give on your own. Okay, so you can give paracetamol by looking at your previous visits doses and all you can give, but again, ibuprofen or any sort of other NSAIDs and all should not be given without consulting with the doctor. Even on OTC like aspirin and all, the many parents will take again the aspirin in children are not at all advisable. Don't take aspirin by any means for the temperature. Okay, so these are the common things that you have to understand when you are managing the fever, and we discussed regarding the when to come to the hospital also. So the rest of the diagnosis part and all, I'm not going to discuss because I don't think it's out of this topic discussion. So we are basically confined to so what the parents should have to do in home, and when you say temperature, what is the temperature and how much is the temperature, what are the different ways of measuring the temperature, and what is the management part, early or initial management of the high fever. So these are the things that we discussed. There are certain things that parents also have to notice when they see the fever or when they're measuring the temperature. So is the associated symptom. This is also gives us a clue or guide to the diagnosis of the fever. So sometimes you have to look for common associated symptoms. One is cold, cough. Okay, these are the symptoms along with the fever. Could be a possibility of viral infection. If you see any rash, again, the rash is two kinds of rash. One is if you press the rash, if the rash is like disappearing and it's coming back, that means it probably is a blanchable. It could be a viral causes. If suppose the rash is not blanchable, that means when you press on the rash is not disappearing, that means it could be something else. It could be a vasculitic rash or it could be sort of meningococcal rash where you have to come to the hospital to evaluate the same. Okay. Then apart from that, if the fever is associated with sort of vomiting, loose stools, or any altered sensorium, or any febrile or any convulsions also. Okay, so or else if the child is continuously crying, or else if the child's neck is rigid, that means the child is unable to flex or extend the neck. Okay, so these are the signs which will definitely recommends the patients to come to the hospital and evaluate the with the doctor, so that like we will not be missing on any of the things. If suppose if all those symptoms are not there and the child is only just having a low grade temperature and absolutely fine with respect to the feeding activity and well-being and urinating and all those things, well, then I don't think you have to be worried much of the bigger, because most of the fevers are self-limiting. It goes on its own following 48 to 72 hours of course. So these are the common things that the parents should be monitoring, should be observing in a in home setups. Okay, so we will. This is how it will be, and we will going to take certain questions. So regarding this thing. So the first question is on Aarti is how many times can we give paracetamol to a child in a day? So you can give like every once in 6 hours. So the once in 6 hours, but again you can give once in 4 hours also. That depends upon the temperature. So if the temperature is lesser than when it's not coming so frequently and it's coming once in 6 hours, then you can give 6 hours. Otherwise, you can give maximum of 4 times also, or it's maximum of 6 times in a day. That's 4 hours once also. Okay. So I hope this discussion has helped you in understanding and managing the initial aspects of fever. So thank you very much.